So with only one action potential, they cannot be released. So we need more action potentials. When we have train of action potential, one after the other, right? Then calcium concentration increases in the synaptic terminal more and more. Then it reaches to a threshold that can activate the release of also this one. So at this stage, we have release of this one and this one. So now we have simultaneous release of neurotransmitters. So we call this co-transmission, but with differential calcium sensitivity, right? Then the next one was co-transmission, but with spatial segregation. One axon is divided into two branches. One of them makes a synapse on a target with a special neurotransmitter. Another one makes synapses on another target with another neurotransmitter. So when action potential arrives, it releases both of these neurotransmitters, but at different locations, right? So this was a review of yesterday's session. Now your mind is ready to get newer concepts, okay? So now, in this figure, you can see some examples of co-localization. For example, in some synapses, we have glutamate in one vesicle, okay? And in other vesicles, we have substance P, which is a neuropeptide, right? So there are some neurons that contain both glutamate and substance P. In other neurons, you may have GABA, and in other vesicles, you may have cholecystokinin, or enkephalin, or somatostatin, or other peptides, right? So these are some real examples of having two different neurotransmitters at the same axonal terminal. So this is only a material for your knowledge, okay? You don't need to memorize the names, so I won't use this for your exam, okay? So now, we have seen that at a chemical synapse, different types of neurotransmitters can be released. They bind to the receptors, right? Receptors can be metabotropic or inotropic. They can cause opening of channels. With opening of the channels, ions may go into the cell or may come out of the cell, right? So then we will have synaptic potential. So let's focus on this, synaptic potential, how it's made, okay? So you can consider a cell which has lower concentration of the sodium inside, and there is higher concentration of the sodium outside, right? In this cell, if the sodium channels are open, what happens next? Sodium goes into the cell from higher concentration to lower concentration. So in the same cell, we consider that we have only sodium. Okay? If potassium channels is open, what happens? We don't have any potassium. Okay?
It's the state of resting membrane.
Yeah. Actually, we are talking about an imaginary cell. Okay? We have a cell that only contains sodium. There is no potassium, okay? So when a potassium channel is open, there is no movement of the potassium, okay? So I want to mention that movement of an ion depends both on the channel and the presence of the ion. Concentration, right? So what happens if we have an imaginary cell with potassium? Potassium is high inside the cell, low out of the cell, right? If the potassium channels are open, what happens next? Efflux. Very good. From inside the cell to out of the cell, right? Okay. Now, if the potassium channels keeps open for a long time, potassium goes out of the cell, right? Then it stops.
When there is equilibrium.
When we have balance?
Yeah.
Okay. So now consider a real cell which has sodium, potassium, everything. And with a real environment. Outside of the cell, we have potassium, sodium, calcium, chloride, everything. Okay? Potassium channels are open. Potassium goes out of the cell. When it stops?
When the balance reaches.
When the concentration of potassium outside becomes equal to the inside.
Okay.
Almost.
So, he says that the potassium stops when we have equal concentration of the potassium on both sides. Do you all agree?
No, sir. No.
No? Why?
Because when the concentration is outside, so like they will repel to each other when the positivity will increase outside. Like we have sodium and calcium. Sodium and calcium will also be in. So the positive ions will increase. There can be the influence of potassium as well at some point.
So you mean that different ions can affect on others?
Yes, exactly.
How?
Because of the
Electricity.
electropositivity. Electropositivity.
Okay. So they mentioned that other ions may affect the potassium. So it's not like this that they stop after having a balance. Okay? So we should also consider the electricity or the electrical gradient. So there are two factors that affect movement of ions, not only one. Gradient, I mean the concentration gradient is only one factor. Another driving force for ion is electrical potential. So inside the cell is negative, out of the cell is positive. We have, actually this happens because we have other ions, right? So when potassium starts to go out, right? Gradually, little by little, inside the cell becomes less negative, more negative, more and more negative. And this negativity pulls the potassium, so it keeps potassium, and the potassium cannot go away anymore. Okay? So, the movement of ions is under the control of the concentration gradient and
Electrical
electrical
potential.
gradient. So, how can we calculate the interaction between these two?
Potential. Less.
There's okay? If instead of ions we had, for example, glucose. Glucose keeps going into the cell until we have balance of the concentration. But these are ions, so they bear positive or negative charges. Right? With movement of the sodium into the cell becomes more positive, and the positivity may oppose further movement of the sodium. Right? And with the movement of potassium out of the cell, inside of the cell becomes gradually negative and more negative. And this negativity opposes further movement of the potassium out of the cell. Right? So in order to calculate the potential at which the ion movement is stopped, we need Nernst potential. So it's like this. Nernst potential electromotive force equals plus minus 61 times the logarithm of the concentration inside, the concentration outside. So for each ion we have different concentrations. So sodium 142 outside, 14 inside, right? So you can put this in this equation, and then you will have a Nernst potential equals plus 61 millivolts.
So can we refer it to as a threshold potential? Because
Threshold potential?
yes.
No, it's not threshold.
Yeah.
It's only the Nernst potential. It means if a membrane reaches this potential, we won't have further movement of the sodium. So when sodium channels are open, sodium goes into the cell. Positivity inside the cell increases little by little, right? It increases until it reaches 61 millivolts. At this point, we won't have movement of the sodium. The concentration of the sodium still is more outside of the cell. But the electrical potential opposes further movement. Okay? So we have two driving forces. Chemical concentration wants to actually push the sodium into the cell, but positivity inside the cell tends to oppose this. At this potential, they are equal. Okay? So we don't have net movement of the sodium. So the net movement of potassium is stopped at this potential. How? We have 4.5 concentration outside, 120 concentration inside. With this equation, we will get minus 87. Right? At this potential, potassium doesn't go out of the cell anymore. Okay?
Minus 87 inside of the cell. Minus 87 inside of the cell.
Potassium goes out of the cell, right? Potassium, if the potassium channels are open, they go out. Okay? So they go out until the membrane potential reaches minus 87. At this potential, we won't have further movement. Right? And also for chloride, we have this. So try to memorize this. 60, about 60 millivolt for sodium, 87 for potassium, 69 for chloride. So it's close to the resting membrane potential. Right?
So among these ions, which cell will contribute toward more resting membrane potential?
Membrane potential.
Which ions contribute toward?
So this one is more important for resting membrane potential. You know, because in the resting state, the membrane has more permeability for potassium than other ions. Okay? So that's why the resting membrane potential is very close to the there's potential of potassium. Okay, so it can be calculated by Hodgkin-Huxley equation. It's different from this one. Okay, you should put all of the ions in one equation. Okay, and also you should consider the permeability. Okay, I told you that if the potassium ions are open, then this happens. Right? Or if the sodium channels are open and keep open, then this happens. But this doesn't happen in the resting state. Okay? They are open only for brief time. So the interaction all together causes the resting membrane potential. Okay? So now, let's get back to the synapse. Okay? A neurotransmitter is released. We don't know the name. Okay? It causes opening of sodium channels. What does it mean? It means sodium goes into the cell. And the ligand keeps the sodium channels open. Right?
Yes.
So sodium continues to go into the cell until it reaches. Okay? If we assume that the ligand is still there and the channel is still open for a long time, so the sodium is allowed to go into the cell as long as it wants. Okay? Then the movement starts at this potential. So we can say actually this doesn't happen because the ligand is actually immediately degraded or reuptake into the presynaptic terminal. So we will have termination of the action. Okay? But in the brief duration that we have the channels open, then sodium goes into the cell. So we can say that the membrane potential goes towards the nearest potential of the sodium. It doesn't reach this, but it goes that way. Okay? What does it mean? It means that the resting membrane potential is minus 17. When sodium channels are open, the change of potential is toward positive potentials, toward the nearest potential of sodium. Now, if a neurotransmitter causes opening of potassium channels, right? Like GABA, like glycine. So, potassium goes out of the cell. It means the resting membrane potential will shift toward more negative potentials. Right? Or, if we have a cell that has a resting membrane potential of about minus 17, then the chloride channels are open. What happens?
Potassium.
Actually, chloride go out of the cell. Okay?
No inside.
and the potential changes toward positive potential, but only for very short amplitude, only 1 millivolt. Okay, if you consider this one. Okay, so this may be confusing for you, but let's stick to this. Okay, so any neurotransmitter which opens sodium channels changes the membrane potential toward positive potentials. We call this depolarization. Did you get this? Any neurotransmitter that opens potassium channels causes more negativity inside the cell toward the nearest potential of the potassium, right? We call this hyperpolarization, right? So when potential goes toward positive values, this means it's going toward the threshold, right? Because, for example, resting membrane potential is about -70, threshold is about -55, right? When the channels are open, sodium channels, sodium goes into the cell, it goes toward the nearest potential of the sodium, I mean more positive potential. So from -70, we are going toward positive potentials. So we are getting closer to the threshold, right? So the probability of having action potential in this cell is
increasing,
right? So the cell is about to be excited. If the change of potential exceeds the threshold, then we will have action potential. If it doesn't exceed, we won't have action potential, right? But the trend is toward excitability. But resting membrane potential is -70. Potassium channels are opened by the action of GABA, right?
Negative.
Potassium goes out of the cell, inside the cell becomes more negative. So the resting membrane potential is going away from the threshold. So this cell tends to be inhibited, right? So that's why we call GABA and glycine that cause opening of potassium channels inhibitory neurotransmitters. They tend to inhibit the cell, right? And we call neurotransmitters like glutamate, aspartate, that cause opening of sodium channels excitatory because they tend to increase the positivity inside the cell, right? Did you get this?
So, but sodium and potassium gates are not open simultaneously.
Simultaneously?
Like when it is going toward the threshold, 3 sodium is going out, 2 potassium is coming inside. So it's not.
No, this is not the action of the channel. This is the action of the sodium-potassium pump.
It is for individual, like when it is going to action potential and depolarization, something like this.
Yeah, but it's different from the action potential. You are talking about the action of neurotransmitters. You are not talking about action potentials. You know, during the action potential, we have opening of sodium channels, and immediately after that, opening of potassium channels. So they are happening on and on, okay? But here we have a ligand that only opens sodium channels, not potassium channels. So sodium goes into the cell, only this. Okay? But if the action of the sodium continues, then the change of potential may open the potassium channels. Okay? The change of potential may secondarily activate potassium channels. So potassiums go out of the cell, so the change of potential goes back toward the membrane. So actually potassium channels can nullify the opening of sodium channels. Okay? So let's go on. Try to memorize this. Okay? Again, here we have a neuron with a resting potential of -65 A, right? A presynaptic terminal releases a neurotransmitter which causes sodium influx. Sodium goes into the cell, potential changes from -65 to -45.
Towards threshold.
It's a difference of 20 millivolts,
20.
right? Plus 20 millivolts. We call this synaptic potential. Post-synaptic potential. because it's toward positive potentials. I told you, we call this depolarization and excitatory, right? So that's why we call this excitatory postsynaptic potential. Excitatory postsynaptic potential, EPS. So any change of potential towards positivity is called EPS.
So, sir, does that mean it will be only initiated with sodium, because sodium can take it to the body?
Yeah, sometimes you may have other neurotransmitters that cause opening of calcium channels. So the calcium is also the same. We have more calcium out of the cell, less inside the cell. Opening of the channels may cause inward movement of the calcium. Again, we will have positivity. Right?
Yes.
Some other time, maybe a neurotransmitter closes potassium channels. So imagine that we have a cell with a resting leak of potassium out of it. Potassium keeps going out. A neurotransmitter comes and closes the potassium channels. So potassium remains inside the cell. Right? So by this way, change of potential will become more positive. So again, we will have excitation. So excitation can happen after opening of sodium channels or closure of potassium channels, right? So here, a neurotransmitter opened chloride channels. Remember, the next potential for chloride was minus 69. The resting was minus 65. Potassium goes into the cell until it reaches about minus 69. So it's more negative than the resting state. Right? The difference is about 4 or 5 millivolts. Right? So the resting membrane potential becomes more negative. It's more, or let's say it's away from the threshold. We call this inhibition, right? So the type of the potential which is generated here is called inhibitory postsynaptic potential, IPS. So from now on.
Sir, what is meant by postsynaptic?
Because all of these are happening in the postsynaptics.
So postsynaptic membrane potential means what?
So this cell has a membrane, right? In the resting state, if you put an electrode into the cell, you will record minus 65 millivolts. We call this resting membrane potential. Okay, so it's a cell actually. So when a ligand causes opening of the channels, the potential changes. So everything is happening in the postsynaptic cell. So that's why we call this postsynaptic potential. In the presynaptic terminal, we had action potential. Action potential arrives, causes opening of calcium channels, calcium going to the cell, then we had exocytosis, release of the neurotransmitter, and now this neurotransmitter open the postsynaptic receptors, right?
So there is also action potential in the postsynaptic membrane.
Yes, but not now. I'm going to talk about this. Okay? Till now, I only talked about postsynaptic potential. It's not action potential.
Yes.
Then
Okay.
what is the function of this postsynaptic membrane?
So, the postsynaptic potential is generated in order to activate action potential. Because dendrites cannot generate action potential. Right? So try to remember and look at me, okay? So, all of these are happening in a dendrite. Right? Dendrites cannot carry action potential. Why? Because for action potential we need sodium channels, potassium channels. In dendrites we don't have enough of them. Right? So if we have a change of potential, sodium channels are not there to be opened. Sorry, okay? So this potential should be conveyed from the dendrite to the axon. In the axon, we have a lot of sodium channels, potassium channels. So if this potential is conveyed to the axon without any decrement, without any decrease, it may activate sodium channels in the axon. And from this point, we will have action. Okay? Now. Yeah, I will talk to you.
Can you explain the last one how it becomes more negative than the resting neuron?
Yeah.
How it becomes 70, like it becomes more negative.
How it becomes more negative? Chloride is going into the cell. It has negative charge. Right? So we will have more negative. So, another thing I remember now. Some neurotransmitters activate chloride influx. Okay? Some other neurotransmitters may activate potassium influx. GABA is a neurotransmitter that can activate both. Because GABA have two receptors, receptor A, receptor B. So we have GABA receptor A, GABA receptor B. GABA receptor A is a channel, chloride channel, like this. GABA binds to the channel, opens the channel, chloride goes into the cell. It's an inotropic receptor, right? GABA B receptor is a metabotropic receptor. GABA binds to the receptor, starts a second messenger system, then the final result is opening of potassium channels. Potassium go out of the cell. So GABA can activate chloride current or potassium current, depending on the receptor. Alcohol activate also chloride channels. So when somebody uses alcohol, it activates the same GABA channels, okay, that is activated by GABA A receptor. Benzodiazepines, like diazepam. You know this? You don't? Do you know diazepam? Diazepam, alprazolam. I don't know everything. Okay, they are used in clinics.
Yeah.
They also activate this channel. GABA. Baclofen is a drug that activates GABA B receptor. Okay, it's used for muscle spasm, for example. Okay, so when it's prescribed by the physician, it activates GABA B receptors in the spinal cord. Cells become more negative, they are inhibited, so they cannot activate the muscles. So muscles are relaxed, becomes relaxed, you know? So for muscle spasm sometimes disorder. So let me go on, okay? So any questions? So you have questions?
Yes.
Sir, for the separate of charges, we need action potential for right?
For what?
For separate of ions and charges.
Yeah.
So we need action potential. If it doesn't have action potential in the dendrites, so how it is going from dendrites toward axon if it doesn't have action potential?
Yeah, I'm going to talk about it. So he's asking that if we don't have action potential in the dendrite, how the synaptic potential is conveyed through the dendrite to the axon. Okay, I'm going to talk about this in other slides. Okay, we call this electrotonic conduction. So, in the next 2 slides, I will talk about this. So, we have seen that the neurotransmitter can activate either IPSP or EPSP. EPSP is excitatory, IPSP is inhibitory. So, in the previous session, I told you that an axon terminal makes synapse on the dendrites, right? But it's only a simplified view of the synapse. In this image, you can see that an axon terminal may also make synapses with the soma, right? We call this axosomatic. It can make synapses with the spine of the dendron or the shaft of the dendron. We call this axodendritic synapse. Or this is a neuron, right? An axon makes contact with the axon terminal of this one. Axonic synapse. So, an axon may activate the dendroid of another axon, the soma of another axon, the axon of the another neuron. Okay? So, we may have different types of synapses. They are not all the same. They have different functions and different power. Let's see. Okay. I will show this in other slides, okay? But now I want to mention another thing. I told you that some neurons may inhibit other neurons, right? So they should release GABA, glycine, dopamine, serotonin, everything which is inhibitory, right? So this inhibition can be of two types, indirect or direct, okay? So imagine that you have a postsynaptic cell like this and a presynaptic cell like this. So ignore these, okay? Don't look at this. You have an inhibitory neuron and a postsynaptic neuron. Let's say it's a GABAergic terminal, okay? So it releases GABA. GABA opens chloride channels and potassium channels. Chloride going to the cell, potassium goes out. Both of them cause more negativity. IPSP. Where do we have IPSP?
In
Synaptic.
postsynaptic.
Postsynaptic, right? So, membrane potential goes away from the threshold, it's inhibited. The probability of having action potential in this cell decreases. The cell is inhibited. We call this direct inhibition. This cell directly inhibited this. It released neurotransmitters directly onto the postsynaptic neuron, right? But now forget this one. See this one. We have three neurons here, right? An axo, let's say dendritic synapse here, or axosomatic synapse here, right? And another synapse here, axonic synapse, right? Let's say this one is excitatory, the purple one. So it releases an excitatory neurotransmitters onto postsynaptic neuron. Sodium channels are open. We will have EPSP, the probability of action potential goes up, right? So this cell tends to be activated. Now we have a third neuron which releases GABA on this one, not on this one. In this axonic synapse, right? GABA causes IPSP in the purple neuron. IPSP means more negative, right? What happens next? This is more negative now. Action potential arrives. Okay? I told you that action potentials open calcium channels, right? So, the more the change of potential, the more the opening of the calcium channels, right? Here, the change of potential was negative before arrival of the action potential. Now action potential arrives, it tends to increase the potential, but it's more negative than the resting state. So we will have only a few or a little increase in the positivity, right? So less calcium channels are open, less calcium is going into the cell, so less neurotransmitter is released. Did you get my point?
Yes.
So less excitatory neurotransmitter is released. So this cell cannot be activated anymore. Okay? So in this situation, we have indirect inhibition. This cell inhibited this one through this. Right?
Yes.
So we call this indirect inhibition or presynaptic inhibition. In the physiology books, you more see presynaptic inhibition. Okay? So they don't use indirect inhibition. I mean, the term presynaptic inhibition is more used than indirect inhibition. Okay? So two types of inhibition are postsynaptic, presynaptic.
Synapse.
Postsynaptic is direct,
Direct.
presynaptic is
Indirect.
indirect. I may ask you in your final exam, where in a presynaptic inhibition process do we have IPS? Okay? Where?
The exoexon.
Yeah. In the postsynaptic cell, in the presynaptic cell, in the inhibitory cell, okay? In all of them maybe. So which one? Only this. So this is an inhibitory cell. It releases inhibitory neurotransmitter GABA. Speak loud. What was the question? Where in this system do we have IPSP? Yeah. So IPSP is generated in this cell, right? This one releases GABA, opens the chloride channels, they go into the cell. This one becomes more negative. So we have IPSP here. Do we have IPSP also here?
Yeah.
No. Why?
Because it's excited.
Yeah, this
Purple
one was
one is
excitatory. It was really, it has been releasing glutamate,
Yes.
right? Or an excitatory neurotransmitter. So this neuron responded excitatorily to this neuron, right? So we don't have any IPSP in this cell, in this system. But in the postsynaptic inhibition, IPSP is generated in the postsynaptic.
Sir, does the exonic synapse always inhibitory or?
No. We may have excitatory neurotransmitters here. Okay? So, in other condition, imagine this one is excitatory, okay? This one is also excitatory maybe. It releases glutamate on this neuron. What happens? The action
More
of this
excited.
one is increased.
Increase.
We call this facilitation. You can see the mechanism here. Okay? I don't want to talk about this because it may confuse you. Okay? So, the final conclusion is that in the postsynaptic inhibition, the presynaptic cell releases an inhibitory neurotransmitters directly onto the postsynaptic cell. So the postsynaptic cell generates IPSP, its inhibitor. In the presynaptic inhibition, a third neuron releases inhibitory neurotransmitters on the presynaptic terminal. The presynaptic terminals makes IPSP. When action potential arrives, it cannot open a lot of calcium channels because the cell was already inhibited, right? So less calcium is released,
Influx.
actually inflow, less neurotransmitter is released, so the postsynaptic cell cannot generate action potential in response to the presynaptic terminal. So the final consequence is inhibition. Okay?
So my question is about the presynaptic inhibition.
Yeah.
Like for example, can it take place like there can be excitation as well in this process? Like see suppose in the purple neuron we have more secretion of the neurotransmitter which excites, for example, glycine or something which excites the neuron.
Yeah.
So that time the yellow one will not have any effect on the purple one. So there will be the excitation in the postsynaptic.
So when this one is not active,
Not that active as much the purple is. For example, it has more glutamate neurotransmitter which leads to more opening of the, for example, sodium channels in the.
so you mean this one releases glutamate?
No, it is less active.
This glutamate? No, this is not called inhibition. So you are talking about reduction in facilitation. Okay? So maybe this one is excitatory, this one is also excitatory. This one increases the action of this on this. Okay? So when something causes elimination of this, right? The purple one no longer is activated by this one. Okay? So it can only release its normal.
No,
Neurotransmitter.
yellow one is inhibitory only, but the excitatory power of the purple one is more. Like because of the transmission of the more neurotransmitters, which leads to the excitatory.
Okay, I got. So you mean that this one is inhibitory, but this one is very strong.
More exciting.
Okay, so in this situation, it cannot decrease the action of this one. Okay, it continues to activate this one. We have this in the CNS. So for having inhibition in this case, we need more presynaptic terminals, not only one yellow neuron. So we need, for example, 10 yellow neurons. Okay, 10 yellow neurons at the same time can inhibit this one, maybe, because it's very strong. Okay, so let me continue. Okay, so okay, EPSP and IPSP is made in a dendrite, right? So you can see that here, this one. This is dendrite, the tip of the dendrite, soma, axon. The location at which we have action potential is here. We cannot have action potential in the dendrites. Sometimes we may have action potential in soma also, because the concentration of the sodium channels is very high here, but is moderate here, and very low
in dendrites.
In dendrites, right? So some presynaptic terminals release excitatory neurotransmitter here. They cause EPSP inside the cell. The cell was minus 60 millivolt, right? Now it's minus 10. So the size of EPSP here is
More.
minus 70.
minus 40.
70.
This is not excitatory, it's just plus.
Plus
40, no.
Plus 50.
Plus 50. Right? It was minus 60, now it's minus 10. So there is a difference of 50 millivolts.
Sir, can
Right?
you repeat this?
So an EPSP with a voltage of plus 50 is made here. So I told you that this EPSP cannot activate action potential in the dendrite. It should reach here. Right? So this change of potential should reach here. But in the membrane, we don't have enough sodium channels. So how it can get to here? Okay? So you know that for electricity, okay, we need a wire, metal wire, or an ionic solution. Cytoplasm is an ionic solution. It's full of sodium, potassium, calcium, a lot of other ions. Right? So electricity can go through the cytoplasm of the dendrite to the soma and to the axon. Right? So we can say that in biological systems, conduction can happen through the membrane by way of channels or through the cytoplasm. If it happens through the cytoplasm, we call this electrotonic conduction. Electrotonic conduction. Right? Did you get this?
Yes.
Conduction of the electricity through the cytoplasm is called electrotonic. Okay? So, another thing. You know that in a piece of wire that electricity goes through, we have some resistance. Right? Some metals have less resistance, like copper, silver, right? Others have more resistance. I don't know, maybe iron, okay? And you know that another thing. If the wire is thick, it has less resistance. It is very thin, it has more resistance. The same also applies for the dendrite. If the dendrite is very thick, it has more cytoplasm, resistance is low. If the dendrite is very thin, then resistance is higher. Another thing is that dendrites are leaky. right? EPS beam is may be generated here, but after that, ions go away, and the potential decreases again, right? So dendrites are leaky and have some resistance. So when a potential goes through the cytoplasm, there will be some decrease in the voltage. Okay? So that's why we have an EPSP of plus 50 here, but as it goes toward the soma, it decreases gradually. Okay? Now it's here, it's plus 40, right? 40, then 35, and so on. Okay? So we have decrease of potential as the potential goes toward the soma and axon. So we call this incremental conduction. So, please. Okay? So, conduction in dendrite is electrotonic. This electrotonic conduction is subject to decrease. Right? Yes. We call this decremental conduction. It only happens in dendrites. Okay? But soma is very large. Okay? It's very thick actually. So resistance is very low here. So when a potential reaches here, there is no more decrement here. Okay? From this point, it can easily reach this point without any decrease in the amplitude. Okay? So let's summarize. Electrical conduction in the dendrite happens through electrotonic conduction through the cytoplasm because of the resistance in the cytoplasm and the leaky nature of the dendrite. The potential decreases gradually. This decrease is called incremental conduction. It only happens in dendrites. When the potential reaches the soma, there is no more decrement. So the potential can easily reach the axon, the initial segment of the axon. Right?
Sir?
So, let me actually wait for some minutes, okay? So, when they come here, they may activate action potential or may not, depending on the threshold. Okay? I told you that there is decrease in the amplitude. Maybe this decrease is high enough to eliminate the EPSP at all. Okay? Only a little EPSP may reach here. So it may not be enough for having action potential. Okay? But if in this process there is only little decrement and the EPSP can reach the initial segment at a high amplitude, then it may cause action potential. I'm going to talk about this in the next slide. Now questions.
Yes. The resistance in the dendrites is due to because of the diameter or any other ions out there?
Yeah, diameter.
Just diameter.
Diameter, yeah. And also the ionic solution, you know, but the more important thing here is diameter. Yeah. Other questions?
Sir,
You have a question?
there is no any channel in the dendrites, ion channel. There are no any ion channels. Ion channels.
Ion channels? So we have ion channels here, but the density is very low. For action potential, we need a lot of channels that should be together, okay, close together. Okay, but in the dendrite they are scattered. Okay, so the concentration is low. I think that there was another question. You? Sorry, I cannot hear you. Sorry? I cannot hear you. To which ion? So, for example, imagine that sodium goes into the cell, it generates EPSP, and the same sodium may go out by way of, for example, sodium potassium pH, or maybe there are some potassium channels that are opened after this change of potential. So potassium goes out. Okay, so sodium tends to increase the potential. Potassium goes out. Okay, please consider here. I told you that EPSP should reach here, right? Now imagine that an EPSP hardly reaches here, initial segment, and there is an axonic synapse here that inhibits exactly this point. So it can block everything here. So all of these synapses tend to generate action potential here, but there are 4 here, they don't want this. Okay? So maybe this one is coming from the brain, okay? But this one is coming from the spinal cord, these. So all of these neurons from the spinal cord want to activate this cell, but only a few fibers from the brain say no, you're not allowed. Okay? So we can say that not all synapses have the same power. Some of them have more power depending on the location. Right? So maybe an axonic synapse has more power than a lot of axodendritic synapses. Okay? So, please don't ask more questions, okay? So let's go on. Okay? So, EPSP is subject to decremental conduction, right? There may be some decrease. So, if you have decrement, and most of the potentials are lost during this conduction, so how the cell is activated? So we have EPSP at the tip of these dendrites. When they go toward the soma, they are subject to decrease. They are lost. How they can reach here in order to activate the cell? Because they are losing their voltage actually, right? So we should have other mechanisms to amplify the signal. We call this summation. 2 types of summations include spatial summation and temporal summation. Spatial summation means EPSPs from different locations are combined together. So we have EPSPs at different points in the space, right? So this is the space of this dendrite. In this space, at different points, we have different synapses. All of these green ones are presynaptic terminals. So you can see that maybe 10,000 to 200,000 presynaptic terminal and on only one neuron. Okay? At different locations. So each of them can generate EPSPs. If all of them are activated at the same time, then we will have 10,000 EPSPs. So at first, all of these EPSPs are very large. Then they go toward the soma. In this way, they lose their amplitude. Okay, they start from, for example, plus 50. When they reach the soma, they are plus 1, maybe. Right? But at the soma, they are combined together because we have a lot of them. And from here, they can go to the initial segment, and now they can increase the threshold, or they can increase the potential to the threshold. So they can activate action potential. Right? So we call this spatial summation. Summation at different spatial locations. Right? Or we may have only a few fibers here, I mean axon terminals here, not a lot of them. But each of these synapses can be activated several times. Okay? So they may have 1 action potential, or maybe they can have 100 action potentials, right? So action potentials can come repeatedly. And with each action potential, we may have EPSPs. So EPSPs can combine together in time, right? and they can generate a very large potential, which is enough for reaching the membrane to the switch, right? So this is called temporal summation, summation that happens in time, right? So this figure shows that if 4 synapses are activated together, it's not enough for having action potential. If 8 of these are activated, they are not enough. But if 16 presynaptic terminals are activated together, then it's enough for having the action.
Sir, can you repeat the temporal summation?
Temporal summation? Yeah. I want to repeat this, but on other slides, okay? So let's see spatial summation first, then temporal summation. So we have a first synaptic neuron, right? Which may have more than one synapses. So here we have 2. Synapse 1, synapse 2, right? Action potential from this terminal activate EPSP1. Action potential in this one generate EPSP2, right? So EPSP1, EPSP2, right? So imagine that they are far from each other. When EPSP1 reaches here, it's lost totally. So it cannot combine with the EPSP2. It cannot have a spatial summation, right? But in other situations, they may be close together, right? EPSP is generated here. When it goes toward this one, it may lose its voltage for example, 50%. But 50% reaches at this point, right? So they combine together and generate a higher voltage, like this. EPSP1 goes toward the EPSP2. In this way, it loses half of its potential, right? It's now here. Then the EPSP2 is generated. The EPSP2 combines with the EPSP1, and then we will have more potential. And if you have several of these, EPSP is very large, so it can activate this cell, right? We call this spatial summation. So remember, more than one synapse. Yeah. This one. So EPSP from this location and from this location can combine together. But if they are 4, okay, this one generates EPSP. EPSP goes toward this one. Meanwhile, it decreases, right? So before reaching this point, it's lost totally. So there will be no combination here. But if they are close together, right? This one generates EPSP. When it reaches here, the amplitude is half, for example, now. But they can combine together. Okay? Actually, there are some academic terms for this or scientific terms for these. I don't want to mention them, but now we call this time constant. Or, for example, I'll get to you, okay? And let's say time constant and I forgot space constant. Sorry, I forgot that. Okay, so there are some scientific terms for this. If they are close together, the result is different than being far.
So is it like it's dependent upon the space or the distance?
Yeah, the distance
between the 2 synapses.
Yeah, it's very important.
If it's huge, then generating the maximum potential, like action potential, is difficult. If
Yeah.
it's near, then it will be like it can create higher action potential.
Yes. It's like that, okay? So, what does it mean? It means that if you have a lot of these synapses, so they are close together. Right? Okay, so, now let's see the temporal summation. So here we have only one synapse. But it has 2 action potentials. Right? Action potential 1, action potential 2. Right? When action potential 1 arrives, it generates EPSP1. When action potential 2 arrives, it generates EPSP2. But the action potential are far in time. The first one reaches the synapse, and after a delay, the second one reaches. Before the second one comes, the EPSP1 is lost. Okay? So when the second action potential arrives, it generates EPSP2, so they cannot combine because the first one was lost before. Right? Now, imagine that 2 action potential arrived immediately after each other. The first one activates EPSP. Before it's lost, the second one comes. So they can combine. Okay? So now you can imagine that you might have 2 million EPSPs, 2,000 EPSPs. Right? So they can combine together and change the potential to the threshold.
In temporal, we just increase the frequency, right?
Yeah, the frequency of action potential is important here. So we call this temporal summation.
Sir, is it depend on the type of fibers? Like we have 3 types, A, B, C.
No.
On that, yeah, it is something else. Sir.
No. It depends on the
number of action potential.
On the frequency of action potential that a neuron can generate. Some neurons are highly active. Other neurons are less active. Okay? So this is an internal property of a cell. Okay? For example, you're tall and I'm short. Okay? So this is our property. Okay? So some cells are highly active, other cells are less active. Okay? Sometimes this cell is coming from a neural network. That neural network can be very active or can be less active, depending on the situation. Imagine that the brain is sleeping now, so the neural network is generating less action potential. Sometimes it's awake, it generates a lot of action potential. So depending on the state, we may have, for example, high frequency or low frequency of action potential.
This question one, the previous one, it depends upon the distance between synapses. Now it depends upon the time difference in the action potential.
Yeah. You mean? Sorry.
Like in this question one.
So in the spatial summation.
It depends upon the distance.
The distances, yeah. And the number also, the number of synapses.
And in the temporal one, it depends upon the time difference between the action potential.
The time difference, yeah. So the delay between the action potentials. So, I hope that you are not tired. Okay?
No, sir.
Break? No, sir, or yes, sir?
No, sir, let's continue.
Okay. So, please let me finish this part because this one is from yesterday's session. Okay, and we didn't start today's session, because actually we started late, right? So let me continue, and then you will have a break. Okay, after 10 minutes, I will give you a break. Okay. Okay. So now, in this image, you can see that a postsynaptic cell receives 3 different fibers. 2 of them are excitatory. One is inhibitory. I. Right? 2 excitatory, 1 inhibitory. So, in state 1, we have only excitatory synapse 1. So only this one is active. The other 2 are not active. So EPSP1 is generated. Is it enough for having action potential?
No.
Okay. Then in the next state, EPSP1 and EPSP2 are happening at the same time. Right? So they combine, they go away from the, they go beyond the threshold, they activate the cell. Right? In state 3, only the inhibitory presynaptic cell is active. Only this one is active. So we will have IPS. So no action potential here. Right? In state 4, E1 and I are active together. So we have EPSP and IPSP. They combine again. The result is an average EPSP, which is low in threshold, low in amplitude. So it's not enough for having action potential. So combining, or let's say integration of the synaptic potentials can happen between EPSPs, IPSPs, or EPSP and IPSPs. Right? So if you have EPSP and IPSP at the same time, they nullify or they oppose each other. Right? So in condition 3, you have activity of all of these 3. Excitatory 1, excitatory 2, and inhibitory. So compare this one with this one. If only EPSP1 and EPSP2 is happening, then we will have action potential. But now both of them are active. But at the same time, we have an IPSP. And this IPSP causes not having action potential here. Right? If only these two were active, we had action. We will have action potential. So, based on this, we can say that the activity state of the neuron depends on the total number of presynaptic terminals that make contact with the postsynaptic cell. So, if the sum of the excitatory drive on a cell is more than the sum of the inhibitory drive, then this cell is in the excitatory state. Right? Yes. Excitatory state can be over the threshold or lower the threshold. We call this supra-threshold or sub-threshold. Oh, if the sum of the inhibitory drive is more than the sum of excitatory drive, then the cell is in the inhibitory state. So now let's see the neuron 1, 2, 3 here. Okay, the threshold of all of them are similar. Okay, neuron 1 is excited by the excitatory drives, although it has also inhibitory drives. But the sum of the excitatory drive is more. So, when excitatory state increases, the neuron actually increases the firing rate. Right? Did you get this? No?
Frequencies?
Yeah, the frequency of action potential. So let me talk about this. Sorry. I should have mentioned this before. Have you ever seen a teacher in a hurry like me? No? So, okay. I was talking about EPSP and action potential. Imagine that you have an EPSP like this. Okay? Which reaches the initial segment. The threshold is here. Okay? So, at this point, we will have action potential. Because it's beyond the threshold. Right? But action potential is ended, and the EPSP is still more than the threshold. What happens next? You will have second action potential. Third one, fourth, fifth. But here we don't have action potential because Now it's this.
Yes, it's learning. Yes.
Right? So, in this case, we have 5 action potentials. So, now let's see another situation. We have EPSP like this. Right? 1 action potential is generated, then we won't have any more. Right? So, a cell can be activated by EPSP with only a single action potential or a train of action potential. The train is defined by the frequency. Okay? So, when excitatory drive in a cell is very huge, it means we will have a very large EPSP. Right? So we will have higher frequency of action potentials. When the sum of the excitatory drive on a cell is very small, it means we will have small EPSP. So the frequency of firing of this neuron will be less. Right? So here, the frequency in neuron 1 increases when the excitatory state increases. I mean, the sum of the excitatory drive increases. Right? So by increasing the excitatory drive, firing frequency increases. But it reaches a maximum. Because this neuron cannot generate more than this number of action potential per second. The same also happens in neuron 2. By increasing the excitatory drive, the frequency of action potential increases. But the maximum here is very lower than this one. Because this neuron is not able to generate more action potential. This is the differences between the property of the neurons. Okay? This neuron has a distinct property than this one. And we have a third neuron. Right? This neuron cannot be activated easily because the threshold is very high. Right? So we need a lot of excitatory drive to activate the cell. But if the cell is activated with only a little increase in the excitatory drive, the frequency of action potential will be very high. So which of these neurons is more sensitive? The first one, because it has the lowest threshold. Which one has the lowest sensitivity? This one. We need more excitatory drive to activate it. The threshold of this neuron is higher. So not all neurons have the same threshold. Okay? For example, some neurons may be activated at -55, others are activated at for example, 45. So we need more potential change to have action potential, right? So we have only 2 slides left. This one says synaptic transmission, fatigue of the synaptic transmission. It means when a presynaptic cell keeps activating the postsynaptic cell, okay, the synapse will be tired after a while. Okay? So for example, maybe presynaptic cell generate 5 action potential per second. It activates this cell at a rate of 5 action potential per second. Okay, 1 by 1. Okay, 1 action potential activate 1 action potential in the next. After a few minutes of this activity, okay, this one keeps generating 5 action potential, but this one may only respond 2 action potential per second. Okay, so we can say that meanwhile there was some changes in the synapse. The synapse is not responsive to the action potential anymore, okay? It's no longer responsive. So we call this fatigue. Why this happens? Maybe the mechanism is loss of the neurotransmitters. So it has some neurotransmitters all of them are released. There is no more neurotransmitter here, maybe. Or maybe we have enough neurotransmitter, but the postsynaptic cell is not responsive because the channels are not responsive. Right? Maybe neurotransmitters are okay, channels are okay, but the ions, the concentration of the ions is actually abnormal now. So all of the sodium went into the cell, so we don't have enough of that, maybe. Okay, so different mechanisms may cause fatigue. The last slide for this topic. Some situations may affect the synaptic activity. For example, acidosis. Lowering the pH from 7.4 to 7. So we call this acidosis. Acidosis suppresses all synapses. And in contrast, alkalosis increases activity of the all synapses. So imagine that you have a patient with diabetes, right? The metabolism of the sugar and fatty acid is not normal in this patient. So their body generates more acid. Ketone bodies? From the biochemistry. So there are acidic chemicals. So we have lower pH in these patients, right? Sometimes they have attack of this acidosis. They have very severe acidosis. After that, all of the synapses are depressed. So the brain cannot respond, cannot generate action potential. The brain doesn't work. The patient goes to the coma. Coma, loss of consciousness. Right? We call this diabetes or diabetic coma. Okay? Some other time, there may be patients that are having epilepsy. Epilepsy?
Yes.
Seizure epilepsy. So in this patient, usually neurons are more excitable than normal. If they have seizure attack, a population of the neurons become active and the brain cannot control these. Okay? So the neurons are activated without any control. So they keep generating action, potential, they cannot stop. The result is convulsion. Convulsion? Yes. Movement in the body, which is uncontrolled. So we call this abnormal contraction of the muscles. We call this a seizure attack. So this patient has a susceptibility for seizure attack, but now it's okay. Okay? But if this patient has alkalosis, with any reason, neurons become more excited, right? And the person is more susceptible for having a seizure attack. So alkalosis in a patient with epilepsy is very bad, because alkalosis may increase the probability of having seizure attack, right? Another condition is loss of oxygen. Ischemia. Loss of blood supply to the brain, right? So ischemia suppresses all of the synapses. So only some seconds of ischemia cause loss of consciousness, right? Because synapses depend on energy. For transmission of the signal, neurotransmitters should be released. So we need a lot of ATP. And the only source of energy in the brain is glucose, right? And when there is no oxygen, not enough ATP is generated. So the cells lose their activity in only 5 or 10 seconds. So 10 seconds of ischemia is enough for loss of consciousness. Okay, this happens in a stroke attack. A stroke? Stroke? Okay, very good. So, another condition is that some chemicals like caffeine, theobromine, increase the excitability of the synapses. Okay, so that's why in the night before exam, you usually use coffee in order to keep awake. Right? So synapses are activated. So I don't want to talk about the biochemical mechanism of this. Okay? You should read this in pharmacology, in biochemistry. But these chemicals activate some intracellular mechanisms that increase the excitability of the cell. Strychnine is a chemical which inhibits glycine neurons. Glycine is an inhibitory neuron. We have a lot of them in the spinal cord. So all glycine neurons are inhibited by strychnine. What happens? We have a balance between excitatory neurons and inhibitory neurons in the brain and also in the spinal cord. When inhibitory neurons are removed, excitatory neurons are not opposed. The balance shifts toward excitation. So this way, they cause excitability of the neurons. And anesthetics, you know them, right? Anesthetics like ketamine, I don't know, maybe N2O, Halotan, isoflurane, sevoflurane, a lot of drugs that are used in operating room. Operating room. Okay, so these anesthetics actually decrease the excitability of the cells. Not specifically, non-specifically, all of them. Okay, so that's why when you inject a drug like pentobarbital to the patient, after 3 seconds, they lose their consciousness. Okay? Increase the membrane threshold.
Yeah.
So they decrease the excitability. Okay? So this was all about synapse and organization of the nervous system.